కరోనా వ్యాధికి చికిత్స ఉండకపోవచ్చంటున్న ప్రపంచ ఆరోగ్య సంస్థ. కరోనా వైరస్ విరుగుడు వ్యాక్సిన్ తయారీలో ప్రపంచం తలామునకలుగా ఉంటే ప్రపంచ ఆరోగ్య సంస్థ మాత్రం ఆ మహమ్మారిని అంతం చేసే అద్భుతమైన ఔషధమేమీ లేదంటూ ఓ పిడుగులాంటి వ్యాఖ్య చేసింది. కరోనా వైరస్ను వ్యాప్తి చెందకుండా ఉండేందుకు మనమే జాగ్రత్తలు పాటించాలని హితవు చెప్పింది. టెస్టింగ్, ట్రేసింగ్, భౌతిక దూరాన్ని పాటించడం, మాస్కులు ధరించడం వంటి వాటిపై దృష్టి పెట్టాలంటూ అటు ప్రభుత్వాలకు ఇటు ప్రజలకు విజ్ఞప్తి చేసింది. ఇప్పటికిప్పుడైతే ఈ వైరస్ను అంతం చేసే చికిత్స ఏమీ లేదని, భవిష్యత్తులో కూడా ఉండకపోవచ్చని ప్రపంచ ఆరోగ్య సంస్థ డైరెక్టర్ జనరల్ టెడ్రోస్ అథనోమ్ గెబ్రీసియస్ తెలిపారు. అసలు ఈ వైరస్ మనుషుల్లోకి ఎలా ప్రవేశించిందన్న దానిపై వరల్డ్ హెల్త్ ఆర్గనైజేషన్ చైనాకు 2 సభ్యులను పంపింది. వారు తమ ప్రాథమిక విచారణను ముగించారని, త్వరలోనే వైరస్ మూలాలను కనిపెట్టేందుకు WHO నేతృత్వంలోని ఓ బృందం చైనా పరిశోధకులతో కలిసి పనిచేయనుందని గెబ్రీసియస్ చెప్పారు.
Good afternoon and good evening. On Friday, the Emergency Committee on COVID-19 met and reviewed the current pandemic. It was a sobering moment coming 6 months on from when the committee advised and I agreed that the outbreak constituted a public health emergency of international concern. At the time, 30th January, there were fewer than 100 cases and no deaths outside of China. When the committee met 3 months ago, 3 million cases of COVID-19 had been reported to WHO and more than 200,000 deaths. Since then, the number of cases has increased more than 5-fold to 17.5 million, and the number of deaths has more than tripled to 680,000. In addition to the direct toll COVID-19 is having, the committee noted the health impact that disrupted services are having on a range of other diseases. That compounds what we already know about reduced immunization coverage, cancer screening and care, and mental health services. A survey of responses from 103 countries between mid-May and early July found that 67% of countries report disruption in family planning and contraception services. More than half of countries reported disruption in antenatal care services, and more than a third of countries reported disruption in childbirth services. On top of the health impact, we have seen the damage COVID-19 has caused socially, economically, and politically. The committee put forward a number of recommendations for countries to continue to implement to bring the virus under control. These range from sharing best practice to enhancing political commitment and leadership for national strategies and localized response activities driven by science, data, and experience. We know from serology studies that most people remain susceptible to this virus. even in areas that have experienced severe outbreaks. Over the past week, we have seen several countries that appeared as though they were past the worst, now contending with fresh spikes in cases. However, we have also seen how some countries, regions, or localities that had a high number of cases are now bringing the outbreak under control. It's not easy, of course. Strict measures may cause their own problems for delivery of essential health services, the economy, and societies overall. The committee acknowledged that member states have tough choices to make to turn the epidemic around. But they were also clear that when leaders step up and work intensely with their populations, this disease can be brought under control. We learn every day about this virus, and I'm pleased that the world has made progress in identifying treatments that can help people with the most serious forms of COVID-19 recover. The committee recommended that countries engage in the access to COVID-19 tools, ACT Accelerator, participate in relevant clinical trials, and prepare for safe and effective therapeutics and vaccine introduction. A number of vaccines are now in phase 3 clinical trials, and we all hope to have a number of effective vaccines that can help prevent people from infection. However, there is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating, and treating patients, and tracing and quarantining their contacts. Do it all. Inform, empower, and listen to communities. Do it all. For individuals, it's about keeping physical distance, wearing a mask, cleaning hands regularly, and coughing safely away from others. Do it all. The message to people and governments is clear: do it all. And when it's under control, keep going. Keep strengthening the health system. Keep improving surveillance, contact tracing, and ensure disrupted health services are restarted as quickly as possible. Keep safeguards and monitoring in place, because lifting restrictions too quickly can lead to a resurgence. Keep investing in the workforce and communicating and engaging communities. We have seen around the world that it's never too late to turn this pandemic around. If we act together today, we can save lives. We can save livelihoods if we do it all together. This week, we're also launching a mask challenge with partners from around the world, and we're encouraging people to send in photos of themselves wearing a mask. As well as being one of the key tools to stop the virus, the mask has come to represent solidarity. Like the safe hands and healthy at home challenges, we're going to be spreading further positive messages about how everyone has a role to play in breaking chains of transmission. If you're a health worker, a frontline worker, wherever you are, show us your solidarity in following national guidelines and safely wearing a mask, whether caring for patients or loved ones, riding on public transport to work, or picking up essential supplies. As well as hand sanitizer, I carry a mask with me all the time and use it when I am in places where there are crowds. By wearing a mask, you're sending a powerful message to those around you that we are all in this together. Wear a mask when appropriate. Keep your physical distance from others and avoid crowded places. Observe coughing etiquette. Clean your hands frequently, and you will be protecting yourself and others. Do it all. One of the areas that we have been continuing to study is the origins of the virus that causes COVID-19. The WHO advanced team that traveled to China has now concluded their mission to lay the groundwork for further joint efforts to identify the virus origins. As a result of these efforts, WHO and Chinese experts have drafted the terms of reference for the studies and program of work for an international team led by WHO. The international team will include leading scientists and researchers from China and around the world. Epidemiological studies will begin in Wuhan to identify the potential source of infection of the early.
Please like and subscribe to Telugu 99 News.
ప్లీజ్ సబ్స్క్రైబ్ తెలుగు 99 న్యూస్.
హలో, నా పేరు రాజీవ్ తెలుగా. తెలుగు 99 న్యూస్కి సబ్స్క్రైబ్ చేయండి. థ్యాంక్ యూ.
Please like, share and subscribe to Telugu 99 News channel. Thank you.
Subscribe to Telugu 99 News.
Hello everybody, please do subscribe to Telugu 99 News channel.
ప్లీజ్ సబ్స్క్రైబ్ టు తెలుగు 99 న్యూస్. థ్యాంక్ యూ.
Please subscribe Telugu 99 News channel.
ప్లీజ్ సబ్స్క్రైబ్ టు తెలుగు 99 న్యూస్.
తెలుగు 99 న్యూస్ ఛానల్కి శుభాకాంక్షలు.
మా ఛానల్ నుండి వచ్చే మరిన్ని అప్డేట్స్ కోసం సబ్స్క్రైబ్ బటన్ ప్రెస్ చేసి పక్కన ఉన్న బెల్ ఐకాన్ని నొక్కండి.